My dear friends, today I'll be discussing about the sign symptoms of myocardial infarction or heart attack. Now, most common sign symptom a presentation for a patient with heart attack or myocardial infarction is chest pain. That the typical chest pain is substernal or below the sternum, or it may associate the left side of the chest. Sometimes it may involve the right side also. And the pain is of diffuse, tearing, burning sensation, and just like heartburn, and it persists for more than 20 minutes. The pain may radiate towards the shoulder, towards the left arm, towards the jaw, towards the shoulders, that is left shoulders, and even towards the back. Even sometimes many patients of heart attack may present with jaw pain. The pain is associated with chest tightness, chest heaviness, chest squeezing, pressurizing pain, and it does not change with position or posture, and it is diffuse and lasts for more than 20 minutes, and it is associated with tearing or burning sensation around the chest. There are various sign symptoms which is associated with chest pain also, just like shortness of breath or dyspnea. Besides, sweating may be there, fainting or feeling faint or feeling tiredness may be associated, and many patients, at least 30% of the patients, may present with atypical sign symptoms, that is without any sign symptom of chest pain. So in women may also present with heart attack without any chest pain. They may present with neck pain or jaw pain or arm pain. So 30% of the patients can present with atypical symptoms, and among women also the presence of atypical symptoms is very common. So women can present with atypical symptoms, that is myocardial infarction or heart attack without any chest pain. They may present with other pain like neck pain or arm pain and feeling of tiredness or fatigue. Now there is another important sign known as Levin sign. What is Levin sign? In case of myocardial infarction or heart attack, the patient may localize the chest pain by clenching of one or both fists on the sternum. So they may show the pain with the help of a clenching of more one or both fists over the sternum. And this typical chest pain decreases with the help of nitroglycerin intake. So nitroglycerin can relieve the pain of the myocardial infarction or heart attack. Now we'll discuss various associated sign symptoms of myocardial infarction. So along with the chest pain, patient may also present with sweating. There may be nausea and vomiting, even fainting also. Sometimes the patient may present without chest pain also these sign symptoms. In women, there may be shortness of breath, weakness, fatigue. Even women may present without any chest pain. They may present with neck pain, arm pain, fatigue, shortness of breath, etc. Weakness or tiredness. And the shortness of breath may be because of decrease in the left ventricular output because of direct damage to the muscle because of heart attack. So in heart attack, because of decreased blood flow to a certain part of heart wall or heart muscle, there may be total destruction or damage to the heart muscle. Because of that, this heart muscle cannot pump effectively, so there is fall in cardiac output, and this leads to the shortness of breath, and even it leads to pulmonary edema also. Besides, because of sympathetic discharge, when the cardiac output decreases, so there is a sympathetic overdrive which is responsible for weakness, lightheadedness, palpitation, abnormal heart rate, and abnormal blood pressure. So blood pressure may change, heart rate, palpitation may be there. This is because of sympathetic overdrive or because of increased sympathetic discharge that may occur in myocardial infarction. Besides, there may be loss of consciousness due to decreased blood flow to the brain. So because of decreased cardiac output, blood supply to the brain is also decreased, and that's why there may be loss of consciousness in brain because of decreased blood flow to the brain. So that is another important sign symptom of myocardial infarction. Besides, there may be sign symptom of sudden death, or patient may present with sudden death also because of cardiac arrest. So severe myocardial damage involving major area of heart may ultimately leads to sudden cardiac death, and which ultimately led to the death of the patient. Besides, some patient may present with cardiac arrest also. So these are the various sign symptoms of myocardial infarction or heart attack. Now we will discuss something about silent myocardial infarction. Now silent myocardial infarction is a such type of myocardial infarction or such type of heart attack which present without any sign symptoms. So it is actually, then how is diagnosed? It is diagnosed later on ECG or by rising of blood biomarkers, cardiac enzymes, cardiac biomarkers like troponin C, troponin T, etc. And it may be present in 20 to 64% of all myocardial infarction patients. And even they can find after death also. Sometimes silent myocardial infarction can lead to death, and on autopsy finding, the silent myocardial infarction can also be diagnosed. So it is mostly common in elderly or old aged patient, as well as patient who are suffering from diabetic mellitus or diabetic patient, and those patients who have undergone heart transplant or after cardiac transplant. So after cardiac transplant, if they suffer from any myocardial infarction, so then they can suffer from silent MI. That is, they can suffer from heart attack without any clinical sign symptom of any disease of the, without any sign symptom of chest pain, without any sign symptom of sweating, tiredness, etc. So in those patients, that is elderly patients or in diabetic patients or those patients who have received cardiac transplant or myocardial transplant, or for those patients, they can suffer from silent myocardial infarction. Now what is the mechanism? So in elderly patients, because of neuronal damage, the sign symptom of myocardial infarction cannot be felt or cannot be manifested because of involvement of nervous system or because of neuropathy. In diabetic patient also, there may be change in the pain threshold because diabetes always affect the nervous system and it leads to neuropathy. So because of neuropathy, it may involve the pain threshold or it may affect the pain threshold, and that's why the patient may not feel the pain sensation or become various sign symptom of the myocardial ischemia or heart attack, that is chest pain, cannot be felt in case of diabetics. Besides, in diabetics, there may be another neuropathical problem, neurological problem known as autonomic neuropathy. Here, because of uncontrolled high blood sugar level, the neuron undergoes damage. Because of that, the sensation of chest pain or various sensation of the heart attack cannot be felt. Besides, there may be some psychological factors which may be affecting in case of diabetic patient also, and because of all these factors, in diabetics there is an increased risk of some myocardial infarction. Even myocardial infarction can lead to life-threatening situation in diabetics because they present to it without any sign symptom of the disease, without any diagnostic chest pain or other sign symptoms. Besides, in case of cardiac transplant patient also, because the cardiac transplant patient may not have the nerve supply properly because of denervation that is done during the surgery. Because of that's why for after cardiac transplant, the patient may suffer from cardiac ischemia or heart attack without any sign symptom of the disease, and that is called silent myocardial infarction or silent heart attack. And how to diagnose? It is diagnosed with the help of ECG or with the rise of cardiac biomarkers like troponin T, troponin C. Even after death, sometimes silent myocardial infarction is diagnosed with the help of autopsy, or it can be an important autopsy finding in some deaths without any sign symptom. So silent myocardial infarction can be life-threatening because here the disease may be there, or there may be heart attack without any proper sign symptom. So intervention cannot be done in right moment. So patient may suffer from life-threatening situation also. Thank you very much.